the Chief Operating Officer of Emplify Health to speak. Thank you.
Thank you, Chief Knott, and thank you all for being here today. As Chief said, I'm Charla Bellin, and I have the privilege of serving as the Chief Operating Officer here at Emplify Health by Bellin. We are proud to partner with the Green Bay Metro Fire Department to bring this life-saving tool to the community. It's the right thing to do, and our investment in PulsePoint aligns perfectly with our mission and vision at Emplify Health. The very first word of our mission is together, a powerful statement of the importance of collaboration in our community, both within our health system and with our partners here. We couldn't ask for better partners than Green Bay Metro Fire and our amazing EMS teams. We want to do everything we can to make their jobs easier and improve outcomes for cardiac patients in our area together. Then there's the vision of Emplify Health, which is to courageously commit to a future of healthy people and thriving communities. This means not just treating the patients within our walls, but taking a true community approach to caring for those we serve, both those who live here and those who may come here up from elsewhere. We know we have a lot of those folks that come here on Sundays, as an example. Our colleagues in the Gunderson region of Emplify Health have partnered with their local emergency responders to offer PulsePoint for the last 3 years. We know from their experiences that these apps are powerful ways to quickly mobilize resources and expertise in case of a cardiac event. And we know from our own medical team, as well as patients whose lives have been saved by an AED, that this technology truly makes a life-saving difference. You'll hear more about that in just a moment. I want to again thank the Green Bay Metro Fire Department and Chief Knott for their partnership and for your diligence in bringing this life-saving power of PulsePoint to our community. And I want to thank all of you for helping us spread the word. I also want to encourage everyone to download the PulsePoint app, register your AEDs and yourselves. Together, we can save lives. To share more about this life-saving power of AEDs, it is now my pleasure to introduce Emplify Health by Bellin emergency medicine physician, Dr. Bradley Burmeister.
Thank you, Charla, and thank you all for being here today. As Charla shared, the Emplify Health by Bellin team is incredibly grateful for our partnership with Green Bay Metro Fire and our other EMS partners. Emergency care most times begins well before someone arrives in the emergency department. Our EMS partners already deliver world-class pre-hospital care, but the PulsePoint partnership is a true game changer for our communities and for the work emergency responders and health systems do each day. PulsePoint enables us to take all the good we're already doing in our communities, the AEDs we already have, the trained experts who are out there, and allows us to connect those dots to bring the resources together with the expertise, and that will save lives. According to the American Heart Association, more than 20,000 people in the US die from sudden cardiac arrest each year, meaning they were living a normal, healthy life, and sometimes these are young people, when suddenly their heart has a sudden emergency that leads to their death. The American Heart Association also reports that while the bulk of out-of-hospital cardiac arrests occur at home, 1 in 6 occur in a public setting. Of patients who experience sudden cardiac arrest, we know that those where a bystander attended to them with CPR and applied an AED had significantly better outcomes than those who did not have immediate care delivery. To give more detail, about 9% of sudden cardiac arrests will survive to leave the hospitals, but those who are attended to right away can almost double that rate. Those numbers, frankly, are not that great, but it is clear that rapid care delivery is essential. Every second counts when someone has experienced a cardiac emergency, and the more quickly we can connect them to the AED and someone who knows how to use it, the better their chance of survival. The better their chance of making it to the emergency department to be treated, and the better their chances of getting home again. We see these outcomes frequently in the emergency department. Too often we see patients who unfortunately too much time has passed before their initial care delivery. It often leads us to wonder, what could we have done to get them that care sooner? And it is clear that PulsePoint is an important solution to some of these problems. Now, when you are out of your home and you witness a cardiac arrest, you may not know where the AED is, but PulsePoint can guide you to one. AEDs really are fairly ubiquitous in our community. You can find them in a lot of places that would really surprise you. There might even be one just down the hall from wherever you are, and that knowledge of where it is essential, and the app can guide you to it. As Chief Knott and Charlotte have stated, we have multiple calls to action today. Register your AED and yourself if you're trained in CPR, and if you're not, consider taking a course in these basic life-saving skills, including CPR and AED instruction. It doesn't take long, and it's so worth it. It's also worth noting that even if you don't have any training, you could still probably use an AED. The machine provides easy-to-use instructions, and it gives you verbal commands for how to use it. You never know when a cardiac emergency might occur and where you might be to help someone save their life. Working together, we can all be a part of the solution. And now I would like to introduce a colleague of mine, Mark Husen, who personally knows firsthand what these devices can do to save a life.
Thank you, Dr. Burmeister, and thank you all again for having me here today. My name is Mark Husen, and I'm an athletic trainer for Emplify Health by Bellin, but today I'm here simply as a husband. On July 1st, 2011, it was a day that changed our lives. My wife, Ann, who is standing right here, is still here today due to two things: CPR and having AEDs available. On that particular day, my wife did everything: biking, running, swimming, and that morning she chose to swim at the YMCA. For some reason, that morning, her heart started to race and caused her to go into sudden cardiac arrest. She was pulled from the pool unconscious, and at that time we did not know she had any cardiac issue. Ultimately, the quick reaction by a lifeguard who was also a nurse and a family friend who was a therapist realized she needed CPR and started that immediately. She was also hooked up to an AED. She was shocked 4 times in the next 20 minutes of CPR being completed. And then the paramedics arrived and took her to a hospital in Appleton. Later on that day, she was transferred back up here to Green Bay to Emplify Health by Bellin, where she now has an internal defibrillator. The main key is having CPR and AED available for all those who have a cardiac incident. Let me be clear, these devices are very safe. You will not get shocked unless you need the shock. It'll just assess your rhythm. So many times it's easier to get hooked up to the AED and be assessed. The importance of PulsePoint is a simple app on your phone, and it will help the patients and others when time is so precious. Even if you're not certified in CPR, the app shows you how to use the AED and what you can do for the victim until police, fire, or paramedics arrive. Thank you again.
So again, as the fire chief of the Green Bay Metro Fire Department, I'm proud to be and excited to be able to announce that we are now a PulsePoint community. This app is specifically designed to develop a large response force who can respond to cardiac arrest-related calls for help. The community-based response is the key to increasing cardiac arrest survivability in our community. Again, like it was mentioned, this is one of the leading causes of death in the United States. It causes over 1,000 deaths a day. But again, we do know that bystander CPR makes a difference. This app will help mobilize a larger team to make sure that happens early, and it makes a huge difference and an impact in somebody's life, as we've learned. So our goals are simple of this program: to raise awareness, increase the rates of bystander CPR, identify AEDs throughout our community, and together improve the overall CPR survivability rate for our community. So in closing, again, thank you so much for being here. Thank you for taking this call to action that we have, downloading the app, learning how to do CPR, and then actually responding to alerts if you should receive them. So this is a great program. It's been very successful throughout our entire country. Over 5,000 communities are PulsePoint communities. So we're very excited to be one of those, and would welcome any questions or any additional information to provide. So thank you very much.
How does it work? I mean, you said alerts, so people can get alerts, like walk
Sure.
through
Sure.
the app,
Yep.
and what people should do and can't do, I don't know.
Right. The simple thing is alerts will be notified in public settings. So if there's a public setting, again, we talked about some of the trails, some of these public buildings, whether it's the YMCA or something else, you'll receive an alert if you signed up on the app that CPR is needed within a within a quarter-mile radius of where you're at. It'll also highlight the location of the nearest AED. And again, if you choose to respond or not, that's entirely up to you in your specific circumstances. But again, the app only shows you those public settings. And again, the idea is to provide CPR early, and again, see that huge increase of survivability for those events. So whether it's in a public setting, whether it's at the grocery store, on the bike trail, whatever it may be, that's where that alert would play into it.
People have to register their AEDs. I mean, and I guess how common is it that now that we're in a PulsePoint community that people will do that, or do you have access to register them? You know.
Yes. Yeah, and on the backside, we'll show you on the backside. There's it shows you actually how to do it. Simple application. Either you can do it on the app or do it online. You could attach photos of what those AEDs look like and where specifically they are. We have a lot in our community already registered, and whether it's a grocery store, whether it's a private business, whatever it may be, those tell you exactly where that's located. The app itself also allows tools for that AED owner to provide proper inspections of those. So it provides the tools and a log, so you get notified that inspections are due. You can record those, and it provides a great tool to help maintain those AEDs too.